Hello, my name is Dr. Bonnie Sullivan, and I am your potential new therapist. I just want to do a quick introduction just so you have a sense of how I work and what to expect from me. My specialty areas began way back when I was 15 years old with an interest in trauma. I wanted to save all the children, and now I've discovered that the best way to do that is to save the adults who are creating their world. And so I do work a lot with trauma still. It is my first love. So I do all kinds of trauma, everything from your childhood traumas to adult traumas, anything from like abuse or dysfunctional families in general, or even down to a motor vehicle accident or having had some kind of natural disaster. I've worked with people who were part of big shootings, those sorts of things. So everything from that to war for my veterans who I absolutely love working with. That's where I trained. I trained at the National Center for Post-Traumatic Stress Disorder in California with veterans. That was one of the places I worked with veterans. And so I do have experience with that as well. We also have everything in terms of adult traumas that are more like abusive relationships, bullying, because it does happen in the workplace and people have to deal with that. And that is particularly difficult if you have a childhood experience of bullying as well. So trauma is probably the first thing I would think about when we're talking about specialties. I do also do quite a lot of work, of course, with things like depression, anxiety. Anxiety is a very common outcome from trauma, but it is also a common outcome from today's world. It's just part of living in today's world. There's so much anxiety. And so that is something I do quite a lot of work with. I like to address these with, I do cognitive behavioral therapy for sure. And I find that dialectical behavioral therapy is very helpful for most things. Everything from you're having a rough time, you're going through a divorce or something like that, that's a temporary thing, to the more serious things like trauma and any kinds of long-standing issues that people can have, including the ups and downs emotional. If you feel like you have difficulty dealing with your emotions, they have a tendency to be very intense and difficult to deal with. That's one place that dialectical behavioral therapy really shines. It does very well with that sort of thing. And that is actually one of my favorite populations as well. I do love working with people who are sensitive and creative and who tend to therefore have quite a lot of intense emotional ups and downs, and that is fine with me. I don't have any judgment against that. In fact, I actually happen to appreciate that with people. And then it's about how do you have that and appreciate it and still function in a world that doesn't really know what to do with your ups and downs. So that's another area for me, is dealing with those kinds of emotional ups and downs that people have, intensity. And of course that can have an impact on your relationships as well. And that's another area that I work a lot with, is relationships. I have one thing that I do, I call it the stay or go protocol. It's for people who are trying to determine whether they want to stay in their marriage or their intimate relationship, or if they want to leave it. And so that is another area that I do quite a bit of work with. Another one that I do work with is mothers and daughters, and this is in particular with daughters who are on their way to growing up or have grown up, and they're trying to determine what kind of relationship they're going to have with their mothers, or on the other hand, the mothers whose daughters are doing that. Today's world, doing the canceling of our family members is very popular, and if that's happened to you, I encourage you, highly encourage you, to seek counseling for that, because that happens even when there's no trauma or abuse in the relationship, and it does cause a lot of harm for people. So that's another area that I can work with. Another one that I do a lot of work with is just in terms of your own inner growth, your journey, your identity, strengthening how you feel about yourself, your own confidence, that inner core of who you are that makes you unflappable. those sorts of things. Like if you can get very solid internally, then whatever happens to you in your life isn't going to destroy you. And that's something that I think a lot of people haven't quite gotten to yet. We feel very destroyed if something big happens in our lives, and that's just simply because we have not been able to or known how to build up a nice solid core within ourselves in terms of who we are. So that's another area I really enjoy working with. I do actually see couples as well, really enjoy that work. Usually with that, I do a lot more work. I tend to do kind of a combination of emotionally focused therapy, and I use some of the dialectical behavioral techniques with that. And then I also I really appreciate Gottman's approach as well. So I do kind of a combination of those things, and it really depends on the person. So this is the other thing to expect from me when you come in. First of all, I actually highly encourage you to contact me for a free 15 to 20 minute consultation first, because that way you're not spending any money and you can get a sense if this is going to be a good fit for you. Nobody wants to waste $220 on someone and then discover it's not actually a good fit. So please feel free to do that, to contact me for that. So that's the first piece of it. And then during that also I get a little bit of a sense, and I can tell you more specifically how I would approach your particular situation, because each one is different. Some people really enjoy getting all kinds of tools, so that's where I bring out all of my tools and a lot of acronyms and all these little programs and things that I've developed over the years. So that's for people who really like that. Some people don't really want that. They don't want me to be teaching them. They just want to be exploring and figuring it out and having me just kind of point things out and help them with different perspectives and different ideas, ask them questions, give them areas to explore further, that sort of thing. The other thing that I also want to mention is I do a lot of embodied awareness and embodied techniques. These come from both the EMDR background, but also from a specific kind of therapy called embodied awareness, developed by Dr. Beth Hedva, who is here in Calgary. And I've kind of taken that and run with it. Sometimes I do it specifically the way I was taught, and sometimes I shift it and change it a little bit depending on what the person needs. So that's, I think, the bottom line, is that I have a lot of tools, and it's really just about what's best for you and what is it that you need. What does your own inner wisdom tell both of us that you need and where you need to focus? So that's a little bit longer than I intended kind of introduction to what to expect from me, but do feel free, please, to reach out to me, and I'm happy to answer any questions you might have and have a short conversation with you as well.